Hi everybody, this is Melissa McBride. I'm coming to you to explain my nursing subculture project for our box of Subculture for English. I've never made a YouTube video before, so this is my first time, so, just bear with me. Nursing subculture has been around for many of years. It started, way back when we had cavemen, when you needed someone to birth their children or a medicine man in order to heal their illnesses and such like that, to now where we have a huge, vast expansion of nursing that is in hospitals, and you have nursing schools and everything like that. I myself am a nurse. I work at Elderwood. I'm an LPN and going for my RN degree. What I did is I put together a box of items that I think kind of explain nursing subculture, and I'm going to kind of go through them. Subculture now today, we actually have things such as Nurse Blake on Facebook. You can actually see, you can see on my phone there, a little difficult. But Nurse Blake goes along to show different things as stories of how nurses, integrate into culture and how nurses have their own culture altogether. He shows a lot of stories about things such as difficult situations were put in, sometimes embarrassing situations were put in, and such like that. I'll start with my box of items that I have put together. As you can see behind me, I have a set of scrub pants and a scrub shirt. A lot of times what I try to do is I try to find some sort of scrub shirt that is fun and, makes the atmosphere when someone is sick, to make them feel a little bit better. Nurses are very good at comforting and providing care for people. They have a vast amount of knowledge that they have to draw on in order to make an appropriate decision as to when their patient doesn't feel good. The next item I have in my box is a stethoscope. Stethoscope is used every day. We use it for respirations and such like that, also to listen to bowel sounds. Pretty much with this, if you don't have a stethoscope, you are not a nurse, is what it goes. Next thing I have is my blood pressure cuff. This allows me to take people's blood pressures, pulses, stuff like that. As you can see again, I got something that has a nice little design on it. Make people feel a little bit better, a little bit more comfortable when they're not feeling the greatest. Next thing I have is a brief. This is kind of like an adult diaper. A lot of times nurses are put in situations that are uncomfortable, you don't want to deal with. Sometimes they deal with bodily fluids. You need to make people feel comfortable, feel that they can reduce their pain and cause them, a little bit more comfortable. The next thing I have is, which I'm sure we have all seen before, is a mask. These masks nowadays, with the whole epidemic that we are going through, are being used on an everyday basis. These I'm actually wearing 12 hours a day, all through my shift, so I do not catch COVID-19. With the new pandemic that has been brought out, it's incredibly crazy how much the nurse subculture is being integrated into actually everyday life, where you are wearing a mask and you are actually having to provide, infectious disease protocols so you don't get sick. So that obviously shows that, nursing subculture doesn't even have its own, it's actually coming into everyone's lives as for now. I have a little pin in here that says, I love my patients. I love every patient that I have. Sometimes they are difficult, but patients can be in pain, or they are sick, or they are hurting. So it's my job to draw back on my knowledge as a nurse and my training to comfort them and make them at ease. Another thing I have in my box here is a badge. It just shows I'm an LPN at Elderwood with my name on it. This is part of the nurse attire that you wear every single day. You are not without it every single day because it lets you into the building. It allows you to get access to places that you need and such like that. The next thing I have are everyday items that I need. A watch, my scissors, my pulse ox, and as always, pens. I always need pens, pencils, pulse ox, watch. All of these are part of the nursing uniform. If you don't have these things, you can't even consider yourself a nurse because then you can't do your job properly. If you do not have these items, you will purchase them yourself. I hate to say your employer normally does not purchase them for you. So when you are a nurse, you have your salary and it actually helps you to get the items that you need. As for how, it's affected me, I use my nursing knowledge every day. As I'm walking through a grocery store, I'm looking at people, seeing if they look ill or if their respirations are okay or anything along those lines. I also honestly have adopted scrub hands as my everyday, clothes that I go around in because it's kind of ridiculous. I can't get out them. But other than that, that's what I have to say about nursing subculture. It's, become a part of my life. That's who I am. I am a nurse. I'm there to care for people, to comfort people, to draw on my knowledge to make sure that when they are sick, I can help them. Also, as a nurse, I've dealt with death and things as that sort. So needless to say, it's a part of my life. It's a subculture of around here. It's now a subculture, I think, of everyday life because of this pandemic. And I think it's here to stay.